Have you ever experienced that sudden, intense muscle spasm or perhaps persistent stiffness that just will not let go? It can be incredibly disruptive, making even simple movements feel like a challenge. When your muscles tense up, finding relief becomes a top priority. When it comes to addressing muscle pain and stiffness, healthcare providers often consider two primary types of medications, generally referred to as muscle relaxants. These are primarily antispasmodics and antispasticity agents, each designed to tackle different kinds of muscle issues. So, why do we have these different types? It is because not all muscle discomfort is the same, and these medications work through different mechanisms in your body. Many of the drugs commonly called muscle relaxants do not actually work directly on the muscle itself. Instead, they primarily act on your central nervous system, specifically the brain and spinal cord, to calm overactive nerve signals. Let us explore the first group, antispasmodics, which are often prescribed for acute, short-term muscle pain or spasms. These medications like cyclobenzaprine, carisoprodol, or tizanidine work by depressing the central nervous system, which helps to reduce the nerve impulses that cause muscle spasms. Think of them as helping to quiet the chatter between your brain and your muscles, allowing the muscles to relax. They are frequently used for conditions like lower back pain or neck sprains, where the muscle is acutely injured or strained. The second group, antispasticity agents such as baclofen or dantrolene, are used for more severe, chronic muscle stiffness or spasticity. This often happens due to neurological conditions like multiple sclerosis, cerebral palsy, or spinal cord injury. These medications work in a slightly different way. Some, like baclofen, mimic a natural calming neurotransmitter in the brain and spinal cord. Others, like dantrolene, act directly on the muscle to interfere with the releases of calcium, which is essential for muscle contraction. This distinction is important because antispasticity agents are typically reserved for long-term management of these more complex neurological conditions. Navigating these options means having an open conversation with your healthcare provider. Since all muscle relaxants are prescription medications, it is crucial to discuss your specific symptoms, medical history, and any other medications you are taking. Your doctor will help determine if a muscle relaxant is appropriate for you and which type would best suit your needs. They can also advise on proper dosage and potential side effects, such as drowsiness or dizziness, which are common with these types of medications. An interesting aspect of many antispasmodics is that their effectiveness often comes from their sedative properties, rather than a direct muscle relaxing effect. While they can bring much-needed relief for muscle spasms, they are generally intended for short-term use to avoid potential issues like tolerance or dependence. Always follow your doctor's instructions carefully to ensure safe and effective treatment. Ultimately, understanding the different types of muscle relaxants empowers you to be a more active participant in your pain management journey. Knowing the difference between how antispasmodics and antispasticity agents work allows you to ask informed questions and collaborate with your healthcare team to find the most suitable, safest pathway to relief. It is all about finding the right tool for the right job, helping you to feel more comfortable and regain control over your body.